name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and today I want to talk about 3 myths when it comes to the diagnosis of ADHD. Now, there are a lot of misconceptions when it comes to ADHD, a lot of which is propagated by misinformation that's spread on social media. So let's talk about it. Number 1, ADHD is not a diagnosis that you can develop in adulthood. ADHD is a neurodevelopmental disorder, which means that it's something that you were born with, and you have to have evidence of symptoms from before age 12. So if you're an adult and this is something that you've developed over the last couple of years, maybe in the setting of certain life changes or stressors, then this is not ADHD. There may be something going on that needs to be addressed, but it's not ADHD. Myth number 2 is that you can get an ADHD diagnosis from one psychiatric evaluation. So I practice in a federally qualified health center as a general adult psychiatrist, and I get referrals all the time for an ADHD evaluation. And patients walk in and they expect to walk out with an ADHD diagnosis. And 95 times out of 100, that's just not how it works. When a patient comes in, I'll be able to assess them for other psychiatric diagnoses, but most of the time, it's either going to require multiple psychiatric visits so that I can get to know the person and their symptoms and maybe gather some more information from other contacts that they might have, or it's going to require an additional referral for formal neuropsychological testing. And this is necessary because there are so many different psychiatric illnesses that can affect concentration and attention, and comorbidity, meaning that having multiple psychiatric diagnoses, is the rule, not the exception when it comes to ADHD. So that means that most people with ADHD have at least one other condition like anxiety or depression or PTSD or autism spectrum disorder that may also be contributing to their inattention. And while those things don't necessarily mean that they don't also have ADHD, it's important to make sure that their inattentive symptoms are not only due to those other diagnoses and that they truly do have an additional ADHD diagnosis. And you really need formal neuropsychological testing to be able to do that. Okay, myth number 3, a trial of a stimulant is not a good way to diagnose ADHD. Stimulants are psychoactive substances that most people are going to notice a benefit from in terms of their attention, their productivity, all of these things. They are biologically very similar to things like cocaine and methamphetamine. So if you say, well, I tried Adderall in college and I could focus so much better with that. Well, that's you and about 100% of other people. So all that to say, in order to make sure that we're prescribing these medications, which are not risk-free, judiciously, we really need to make sure that an individual has a diagnosis of ADHD prior to prescribing a medication like a stimulant. If you have questions about this, feel free to share in the comments below. Wishing you all good mental health today, and I hope to see you in the next one.